everybody. Welcome to week, I think, 13. I'm not really sure. On Transcribers FTM. This is another Snappy Sunday with darling Nickie, and this week we are talking about surgery.
Surgery.
Surgery!
Surgery. No, not Sophie. Surgery.
No, Sophie, go. We didn't call your name. Okay.
Alright.
Alright. So the first question is, has your boyfriend or partner already had surgery during his transition process? If so, which specifically? And the answer is no.
No.
Not yet.
No surgery.
If he has not already, does your boyfriend or partner plan to have any kind of surgery during his transition process? And the answer is yes.
Yes, surgery.
And if so, which?
Top surgery.
Perfect.
Yep.
If your boyfriend has already had surgery, please talk about your experience surrounding it. NA. Not applicable. If your boyfriend is planning on having some kind of surgery, how do you feel about it? Please discuss. Okay, well, okay. This morning we were talking about what we were going to say in the video. Gabe's like, how do you feel about it? And I'm like, it's fine. Like, literally, that was my response. It's fine.
She's like,
I seriously, like, took a drink and said,
it's fine.
it's fine. It's fine. I don't think it's for everyone. I will say that. I don't think it's for everyone. And we kind of started talking about this. I think that while it's really frustrating that top surgery is so expensive, I almost think it's like almost a good thing that it is that expensive, because if it were really cheap, it would be much more accessible, more readily accessible, and then therefore people could rush into it more. But I think the fact that it's so expensive and that most people have to really save for it, gives you a lot of time to really think about it and make sure that that's something that you want, because it's so permanent. And we were watching the special on TLC about these people who transitioned and, you know, either MTF or FTM, and then we're like, I don't want this, like, I'm not happy and I want to go back. And you know what? That's not really that possible. I mean, it is in some aspects, but, you know, the surgery is fairly permanent.
Yeah, and it also kind of prevents people who are questioning from just having surgery. And like Nickie said, it's really permanent, so the cost and the fact that you have to generally have real life experience living in the gender that you identify in for a period of time like that will kind of, it delays it for a lot of people. You can't just rush into it, so
I think that's good.
it's a good thing.
And I don't think it's for everyone. I don't think that everybody's transition is going to result in surgery necessarily anyway, even if it is affordable for them. I don't think that it's necessary for everybody.
No, it's not right for everybody, but
Right. All right. So next question. So that's how I feel about it. It's fine. Has your boyfriend considered bottom surgery? If he hasn't already had it, why or why not? And I'm gonna let Gabe talk about this because he knows a lot more about it. But I will say that no, he has not really considered that.
well, that's not true.
Well, you've considered it and researched it, but
I've
it's
thought about bottom
right.
surgery a lot. But as far as I'm concerned, I don't really think that the surgical options that are available are functional. And if I'm going to have to pay, more than $10,000 of my own money, like in cash, especially, to have a majorly invasive surgery, I don't want it to be not functional. I mean, it's a major surgery and it's very expensive, and I'm just not impressed with the surgical options that are available right now.
there's a chance that everything could work and be great, and that the surgery can go well and it will be functional, but there's also a chance that it might not, and it's just it's very risky, I think.
Yeah, and it's expensive.
It's very expensive. And the procedures are not at the point where they're totally, like, what am I trying to say?
Well,
they're not developed totally yet,
right,
per se.
Like, MTF bottom surgery is a lot better than FTM bottom surgery. And until they are constructing genitals for FTMs on that level, I'm not really interested. And if you guys know people who have had bottom surgery and are happy with the results, that's great, and I'm glad that it's working out well for them. It's just not something that really works for me right now. So
It's pretty risky. Alright, what's our next question, Gabe? Is it this one? Yeah. How important do you feel surgery is to one's transition. We already talked about how we felt about bottom surgery, but how important do you feel surgery in general is to one's transition? And we kind of touched on this, but I personally don't think it's that important. I don't think surgery or binding or packing or any of those things make you who you are. You are who you are regardless of that, because if you're going to say, you know, you can't be trans or you're not trans identified unless you've done this, and this, you know, that's not really right, because there are a lot of people who, one, can't afford those kinds of things, and two, who might not want them, but that doesn't mean they don't maintain or have a trans identity.
Right. I mean, I don't think that hormones and surgery and all of that makes you trans. I think that, you know, just are trans, and that those are things that you do to help yourself feel more comfortable, but, I mean,
It doesn't make
it doesn't make you.
Right. And you know, I mean,
You don't, if you have surgery and all of that, like, it doesn't make you more trans.
yeah, that's kind of a weird thing in the trans community, how it's like this hierarchy almost of like, oh, if you're post-op and you've been on T for a certain amount of time, then you're like higher up on this hierarchy than if you are pre-op and have only been out for a certain amount. You know, it's like you can't be more trans than someone else, and I think that's a misconception in the trans community. I feel like.
And that really bugs me, because, like, guys who are post-op and who have been on hormones for years now, like, you were once at that point where you were pre-op and pre-hormones, or you were 6 months on hormones and you were pre-op. Like, you've been there before, and you were there, so...
But not all guys that are
No.
post-op are like that,
No.
I want to say. Because I know even on YouTube there are a lot of post-op guys that are super, super cool and kind of are saying what you're saying too. But it's kind of an interesting thing, because when you meet a trans guy, they'll be like, oh, how long have you been on T? Or are you pre-op, post-op? Like comparing those stats or something. And that's, I don't know, I don't think you can be more trans. Either you have the soul of a man or you don't. Either you identify as a man or you don't. It's not like if you have this and this and this, you're more of a man than someone else.
Mm-hmm.
That's weird. Okay, we're getting off topic, but I wanted to mention that.
Sorry.
That's cool. What other options are there for people who do not desire surgery or who may not be able to afford it?
Well, of course, you can bind, if you're interested in tops. If, you know, if it's your top that you're concerned about, you can bind. And I think most guys I know bind. I've known a few guys who are just amazingly flat-chested and
Haven't had to or wanted to?
haven't needed to, really. Sorry, cat nonsense. You know, and they were guys who, when they were living as females, didn't wear bras because they didn't need to. And then as far as, like, bottoms go, I mean, you can always pack. Have you guys done a thing about packing?
I think so.
Yeah.
I
You
can't
can
remember.
pack. I mean, I know a lot of guys who don't pack. I know a lot of guys who do. I mean...
Oh, we talked a little bit about it during our week when we talked about sex. That's what we talked
Maybe
about. We
they
talked
should.
about, like, prosthetics and all that kind of stuff.
Right. So, I mean, there are, as trans men, we definitely have a lot of options available to us to, as far as clothing goes, to kind of create a male body if you can't surgically have one or you don't naturally have one. So that's kind of cool.
Yep.
I'm sure that was awkward and offensive, but I'm sorry.
That wasn't awkward. That was good. Thank you. How available are surgeons who perform FTM surgeries in your area? We actually have one really, really good surgeon that's about, 3 hours, 2.5 hours from where we live?
He operates out of the Cleveland Clinic, which is
In Cleveland?
a huge medical hospital. They do a lot of research. They do a lot of different types of surgeries and medical procedures.
They're one of the leading hospitals, in the country, definitely.
Yeah, and his name is Dr. Medali, and a lot of guys in the Midwest region go see him, and I'm going to go see him probably. Guys have said they've had a really great experience with him.
Right, and we've seen a lot of guys who have had their surgery with Dr. Medali, and, their chests look great.
Yeah.
Really great. And he really cares and does proper follow-up, and...
His staff is really, they treat you appropriately, and they're respectful, and he's very respectful.
Good. Oh, we're running out of time. We've got 20 seconds. So yeah, I guess that's it. We'll post a link to how you can get in contact with Dr. Medali, and we'll see you all next week for another edition of Snappy Sundays with Darling Nickie. Gabe.